Hello everybody. In our last video on sports injury, we talked about meniscus tear and its treatment. Today we take up injury to the ligaments, commonly anterior cruciate ligament or ACL. ACL ligament provides a strong support in the knee joint. It stabilizes the movement between femur and tibia. Any patient who sustains a rotational injury to the knee, especially while playing sports like soccer, maybe cricket, or even racket sports. A patient with an ACL tear will develop a sudden give way feeling of the knee. This will be followed by a lot of swelling and pain, primarily because ACL ligament has a rich blood supply, and any damage, whether it is partial or complete tear, will lead to lot of bleeding or hemarthrosis inside the joint. So a patient who has sustained a twisting injury to the knee and is finding it difficult to walk or stand and feels that the knee may give way, there is a high risk of ACL injury. All such patients on primary evaluation should be treated with cold packs, gray bandage strapping, anti-inflammatory medications for first 3 to 5 days. If the orthopedic specialist feels that the injury is of a higher grade, they may advise MRI scan at the first evaluation. If the injury is of a mild to moderate grade, they may try a conservative treatment option for 5 to 7 days before ordering further investigation. ACL injury can be a partial injury or a complete injury. Sometimes the damage happens in between the substance of the ligament, or sometimes the damage may happen at one of its attachment, whether to the femur or to the tibia. Patients who have partial ACL tear do not have overt instability. They are able to walk around with a reasonable ease, but when they try to run fast, they may feel some instability. In terms of treatment, first we have to achieve at the correct diagnosis, so MRI scan is helpful there. If we have a patient of a partial tear, we give them a chance to heal back using natural methods, which includes physiotherapy, some collagen supplementation. In a patient with complete tear, if the person is young, within the age frame up to 30, 35 or 40 years of age and leading an active lifestyle, a surgical reconstruction of ACL ligament is often recommended. But a person with a sedentary lifestyle or an age above 40 years of, we may at times advise them to help heal the injury using other conservative methods. One such method which has shown a promising result, we have used this method in young boys or girls in the age frame of 15 to 17 years who are active in sports. We have been able to help them recover to 95 to 99% functional improvement with the help of some injections inside the knee joint. These injections are prepared from patient's own blood. We call them platelet-rich plasma and a growth factor concentrate. This pattern or this method utilizes body's own healing mechanism of growth factors. The process involves taking a blood sample, activating the growth factors, centrifuging to separate the red blood cells and white blood cells, and injecting back a solution which is rich in plasma, platelets and growth factors. A lot of our patients who have been advised a surgical reconstruction of ACL have opted for this plan and shown significant improvement. So, for a broader understanding, a complete ACL tear in a younger age group, at times we may recommend for a surgical reconstruction, but partial tears or all those patients who are in a more sedentary lifestyle may opt for an injection method as well. So if you have been diagnosed with ACL tear and you are not convinced with whatever treatment options you have been advised, you are more than welcome. Please feel free to reach out to us. We will be happy to help.